Health Focus is brought to you by National Medical Stores, NMS, passionate about your life. The COVID-19 pandemic exposes the existing link between non-communicable diseases, communicable diseases and health emergencies, and the need to stop addressing health issues in silos. Both COVID-19 and NCDs are indiscriminate killers, reinforcing one another and disproportionately impacting the poorest communities around the world and the most vulnerable people in every country. In Uganda, non-communicable diseases account for up to 100,000 deaths annually, and there is no doubt that people living with NCDs have been affected by measures to prevent the further spread of COVID, especially the lockdown. Last month, NTV's story highlighting the plight of Jane Nantale, who could not access treatment for diabetes, touched many. Nantale lost a limb to severe diabetes, and she could lose another due to delays in accessing medical treatment.
nga tugenda Entebbe ntufuna eddagala naye kati eddwaliro baaliggala tetukyalina we tujja ddagala tuliko omuntu weeyiya n'ogamba kakanjiye nkolese kino nkolese kiri naye nga tetukyakola ki.
Christopher Kwizera, the program manager at Uganda Non-Communicable Diseases Association, says reports from their up-country offices show that many other people are going through a similar struggle like Nantale.
One of these things that they should never miss their doses. Even when there is no COVID-19, if they miss their doses, the disease tends to complicate. Now in this case, if they miss their dose, and maybe by bad luck or by any chance, they get infected by COVID-19, then it becomes even more complicated.
Kwizera adds that many health facilities have been prepared to handle COVID-19, leaving out other illnesses. This, according to him, denies people with other existing medical conditions services.
There should be a plan to have either mobile pharmacies or have community health workers or staff who probably could be facilitated to be able to deliver medicines for those who need refills.
I've advised people living with non-communicable diseases that they are likely to get severe disease if they get COVID. So it is in their interest not to go to the health facilities. When it is absolutely necessary, they should go and get their treatment. How do they go? They call the sub-county chief and tell them that we are going to the health facility and they can use any means possible.
At the start of this month, the World Health Organization selected a working group that will help increase its reach to people with non-communicable diseases. WHO also encouraged governments to focus on the vulnerable groups at large. Dr. Gerald Mutunji, the Acting Commissioner for Non-Communicable Diseases at the Ministry of Health, says some interventions are being put in place to help people with NCDs access treatment easily.
We have also advised our health facilities that when they come, these are people who are more at risk. They should strictly observe the precaution measures that we have put in place, but also given longer duration of appointment. If they have been coming every month, they can come every after 3 months. They can get their treatment for 3 months or 2 months. Or even when the treatment is not there for 2 months, they are given a prescription that they can get their treatment at a nearby pharmacy so that they don't risk themselves coming to the health facility where there are many people.
But Kwizera says a lot more needs to be done, especially in tracking these patients.
Health facilities, especially regional referral hospitals, general hospitals, and national referral hospitals that run non-communicable disease clinics come up with electronic files where they have all the details of these patients living with non-communicable disease so that they can monitor them online wherever they are.
Unfortunately, in the non-communicable diseases world or space, we are not as organized as our colleagues in HIV. Many patients, we don't have their contacts. And even those with contacts, sometimes we've called them and the contacts are not there. So as much as possible, our health facility will follow them up.
As the country continues to ease the lockdown, it is still uncertain how long it will take to have public transport resumed, which can enable patients receive timely treatment. But in the meantime, the Ministry of Health urges those who may require medical services to utilize the available means. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.